of Women's History Month, we've been covering some important topics pertaining to women's health. And this morning, we're expanding on that. I recently spoke with Dr. Marcy Crouch, a pelvic floor therapist dedicated to filling the gap in maternal health care. This morning, we're talking about pelvic floor health, and you yourself, you're a therapist working to address the gap in maternal health care when it comes to this topic. And we'll dive into that in just a little bit. But first, can you just talk about what pelvic floor issues look like and how common they are in women?
The most common pelvic floor dysfunction or symptoms would be leaking urine or fecal matter, pelvic pain. This could be difficulty with insertion of menstrual products or being intimate with a partner, pelvic organ prolapse, where your organs sit a little bit lower in the vaginal canal. And the thing that we have to kind of be careful about is that these are so common. 1 in 3 women over the age of 20 will have some sort of pelvic floor dysfunction. And because it's so common, it's become equated with normal. And that's where there's a big problem because women are told, especially after having a baby, that all of this dysfunction is normal. It's like totally fine.
How does this issue relate to the gap in maternal health care?
There's already so much missing for women in terms of healthcare, especially in their reproductive years. I mean, we know this. This is documented. I mean, it's been going on for centuries. Specifically speaking about pelvic floor dysfunction, if somebody has a pelvic floor injury during delivery, let's say like a vaginal injury or a tear that affects the function of the pelvic floor, this can lead to a 223% increase in postpartum depression or anxiety. And that's also related to a woman having leakage during her pregnancy. So if she like sneezes when she laughs, which everybody does, that's associated with this higher positive postpartum depression and anxiety screen. So we're missing this whole idea of prevention of pelvic floor muscle injury during delivery and treatment of it afterwards.
What can be done to address pelvic floor dysfunction?
We have to think about this the same way that we're thinking about it with our athletes. So there's the prevention and the training aspect, right? Just like female soccer players, like we know they tear their ACLs. So we try to prevent that by training and studying and figuring out why that happens. So same thing for birth injuries. We need to be preparing the body, training the body, identifying these risks, modifying how we're performing vaginal deliveries to mitigate that and reduce the risk of these significant problems. So one way to combat it is the prevention piece. The second way really needs to be focusing on early intervention and rehabilitation of the muscle, and then progressive training and rehab afterwards to decrease the symptoms and dysfunction and protect against further injury.
As you mentioned, this can be a difficult topic for a lot of women to talk about. What advice
Yeah.
do you have for women to kind of lessen the stigma when it comes to talking about this, or maybe even bringing it up to a doctor, a therapist, or a loved one?
So, what I tell women and what I tell my patients is that you have to find a provider that will listen to what you're saying and will recognize that it is impacting your life and it is a big deal. And if somebody, anybody in the medical community, physical therapist, doctor, nurse, whoever, brushes that aside, then that's kind of a red flag because we know that these issues have long lasting and significant psychological, social, mental, physical problems. So if you're feeling like you can't talk about this with your provider, then we need to find a new provider. I've been in the clinic for over 13 years. And this is the only type of physical therapy that I do. And I've had the opportunity of kind of working all over the place because of my husband's job. And every single state that I've worked in, every single type of practice, it's the same thing. Women are saying, nobody told me about this. I wish I had known about this sooner. I don't have access to a pelvic floor PT. So I decided that that can't be the norm. Like that can't be the standard of care. So I created an online program. The Down There Doc is the brand. And we have a birth preparation course. We have an early recovery course, and we have a postpartum power course, which is all about reducing risk of injury during delivery, what you need to be doing in that critical time period of early recovery, and then from 6 weeks beyond when we get kind of like the all clear.
Mm.
And I created all of this as a way for women and birthing people to understand that like they have a voice in this.
And if you'd like to learn more about all that Dr. Marcy Crouch does, you can visit her website at thedowntheredoc.com. You can also find her TikTok and Instagram at thedowntheredoc.